Health and wellness have taken on special importance as we navigate this pandemic, but for some, equal access to care isn't always easy. Fox 13's Bill Wixie explains.
Providing health services and resources across all the diverse communities in Western Washington is a huge challenge, especially when facing an ongoing pandemic. And as part of Hispanic Heritage Month, this week's Healthy Living takes a look at the challenges faced by the Hispanic and Latinx communities in Western Washington. Joining us this morning, Dr. Julian Perez, a specialist in family and sports medicine at CMAR Community Health Centers. Good morning, doctor.
Good morning.
So as we celebrate Hispanic and Latinx history and culture this month, what are some health issues that are facing the Hispanic and Latinx community specifically?
Thank you for the question. Specific health issues our communities face. I want to start by saying that the Latino and Hispanic community is a very diverse community. We have people that are, in the top 1 or 0.1% of income in this country, as well as we have people that are in the bottom 0.1 or 1%. Folks that are U.S. citizens, third generation, and folks that are have only been here less than a year are still trying to learn English. And so that's a huge diversity to generalize. But I want to speak mainly to the patients that we see in our clinics, which are clinics that take care of the underserved folks, uninsured, Medicaid, immigrants, and refugees. And in that population, COVID is the #1 health issue right now. And that may or may not be agreed upon by the community we serve. You talk with them, their main concerns are the rent. Can I get to work? Who's going to take care of my kid? My wife's pregnant and she needs to go to the hospital. How am I going to get her there? These are very real world, tangible challenges and barriers to health and well-being that our patients face on a day-to-day basis. But in traditional times, diabetes, obesity, hypertension, those are the typical chronic diseases our patients deal with. And more so than ever, depression. A lot of depression, a lot of anxiety right now.
So let's start with the COVID vaccines. I mean, how is CMAR specifically addressing disparities in the Latin community, accessing COVID vaccines and getting other healthcare services?
Right. So CMAR Community Health Centers, we're a federally qualified health center. Our mission, #1, is access to care. And we have probably 35 or so medical clinics up and down the I-5 corridor of Western Washington. And what we did at the very outset of this pandemic is we did not close our doors. The CDC and the federal government said, please, federally qualified health centers, stay open, continue to serve the primary care and preventive care needs of the community you serve. And we did. And we took a real hit to our it was a lot of stress, right? It was a stressful time. But we did it because we knew people needed access to care. And that mission is what has given us the trust of the community. So now, even today, when people need a vaccine, they can come to our clinics, any one of the medical clinics, without an appointment, walk right in and say, please vaccinate me. We will offer them any of the 3 FDA-approved vaccines, either the Johnson & Johnson, the Moderna, or the Pfizer vaccine. We give them a little bit of counseling if they need to, and we will recommend one that's best for their family and for them. And that is something we have done since the vaccines became available. And to date, we have vaccinated, if I'm not mistaken, almost 300,000 shots in arms.
That is fantastic. And as a health expert, I mean, you know that the way out of this pandemic is to get more people vaccinated. So what is your pitch to people who are hesitant?
What you said is true. The only way out of a pandemic is vaccine, or for enough people to get sick all at one time to create a natural immunity. And we are in a globalized world. Our patients come from so many areas. We have patients from 50 countries in our clinics. And can you imagine, in a disease that can kill up to 5% of the people that get ill if they have no access to medical care and no access to hospital care? If everybody had to get sick all at the same time, 5% of the world dying, that is unimaginable. That is a horror that no one should even try to go to mentally, let alone physically. And so the vaccine is the only ethical and reasonable way to protect everybody. And those goals are not just, to reduce death and suffering, but things that our patients care a lot about, like they want their kids in school. My kids in school. I want her to stay in school. I want to make sure everybody's vaccinated and everybody around her is vaccinated until she can be. And remember, we can only vaccinate 12 and above right now. We're hoping very soon to receive FDA approval for 6 and up under emergency authorization. And that's going to be a game changer. But for right now, I think, do it for the kids. Do it for your kids. Do it for my kids. We're in this together. We say this all the time on the radio, juntos venceremos. That means together we win. And it really is true.
There you go. Julian Perez, a specialist in family and sports medicine at CMAR Community Health Centers. Thank you, doctor, for your time. We appreciate it.
You're welcome.
And for more on our healthy living stories, head to our website, fox13seattle.com, and just click on Healthy Living.